And just like that, we got magic. We're recording. So I'm very pleased to have a good friend of mine, Dr. Meghan Teed, on the show, the scoliotherapist, as she's more famously known across social media. So, Doc Meghan, thank you for coming on.
Thanks for having me, Pete. Happy to be here.
So it's very interesting technology, the way it works today, and that you're one of my neighbors. You're a few hundred feet down the street, and here we are doing it on video because it's much easier to do than setting up cameras all over the house or wherever we're going to be. But if you were 1,000 miles away, it makes it much easier. And as you have your own podcast, which I'm sure we'll talk about some today, you're finding out how technology is changing the world for the better.
Yeah, it's been amazing to be able to talk to different people and have access to them, their knowledge base, and it's just at your fingertips there. So pretty cool.
So as I wrote my theory many years ago, and it was Golf Paradigm, and then of course that's part of the 360 logo, and on Golf 360 we talk all about things associated with golf, and one of the 5 pillars, so to speak, was the physical aspect of golf, which is your expertise. You're a doctor of physical therapy. You have a lot of different modalities you work with, and I'd love to get on all those today or during this episode and pick your brain, as we've talked many times over dinner and fireside chats and with your husband. And it's so as you said before we came on, you're not exactly sure because you're not a golfer yourself, even though you're married to one. But as I'm sure we go along in this, and everybody listening and the subscribers or listeners that I have, most of them have come to the point or understand that, we have a very wide reach, hence the name. It's all encompassing 360. Anything has to do with golf. And as many golfers are playing more and becoming injured or need some help getting back to playing, that falls right into your lane of expertise. So just so and I'll go over it in the intro, but just give a real, brief background on your doctorate and your thesis and your education. So someone out there who might be saying, well, who is she? That they have an idea. You can let them know.
Yeah. So I have my doctorate of physical therapy, and I graduated from University of Pittsburgh. I've been a PT for 12 years, and I focus primarily on people that have scoliosis. So I have scoliosis myself, and that population is bigger than you may think. It's a very underserved population as well. So I've gotten my certification in Pilates for scoliosis and the Schroth method, which is the gold standard for treating scoliosis. I do treat other orthopedic injuries. My specialty, just really is the spine. But, I can treat anything. I've been trained in that. I do dry needling as well, which has been an amazing adjunct and addition to my toolbox that I'm able to use with my patients. And
I can attest to that one. Yeah, the torture. I refer to it as a torture chamber.
We just did a little dry needling session earlier today. So,
yep.
But yeah, it's one of those things where with manual treatments, as a PT, you tend to really take a beating on your own body, your hands and your shoulders, your back, after a while. So being able to use something that takes that stress off of your own body, I'm able to practice what I preach a bit. And do some self-preservation there, and it's really effective. So
obviously the back is the number one injury for golfers at all skill levels. So whether someone's out there, they're a relatively new beginner, been playing a short amount of time, and they're golfers tend to be very jump in completely. Like they'll go to the range for hours on end, even though they're just beginning, or even if they are accomplished, they'll stay out there for hours. And the golf posture is really not conducive to a healthy spine. Are there things that you see, because again, you're married to a golf pro and you've been around enough of them, and you obviously know the swing and you know the body fantastically well. Are there things that you see that golfers should be doing that they're not in order to help protect their spine in a sport that's so probably bad for the spine in general?
Yeah. Are we talking about amateur golfers or pro golfers?
Well, let's talk about both. Let's talk about what the bulk of probably listeners are is the amateur, your average everyday golfer, that your club golfer that's a member at a golf club, or they're a weekend warrior. They're maybe playing on the weekend, and they're playing once during the week, or trying to get in a practice session during the week. What do you see that they should be doing, but maybe they aren't?
Yeah, I see often, especially with the population I work with, a lot of retirees who have orthopedic injuries. They go and they're just starting golf, and they know that something's wrong with their swing, and then they're coached to do a bunch of drills to address that issue with their swing. And in the process of doing those repetitive motion drills, they get an injury. Instead of possibly making some adaptations to, the way that their stance is, that may help to improve their swing maybe a different way than doing really repetitive drills over and over again. That's probably the number one thing that I see. The other thing is a lot of people maybe don't have a history of exercise, and this is their way of being active, and their body isn't trained up to be able to withstand that force of that, repetitive rotation and the impact and all of that. So I really recommend trying to get a movement routine under your belt, and that doesn't have to be an hour. It could be a couple of minutes a day, 5-10 minutes, that you're doing in addition to your golf routine that is comprehensive and is helping to condition you to prepare you to play golf well.
What would be an example of something that would, let's say, 15 minutes or 20 minutes, which most people, nobody out there can say they're so busy.
Right.
Unless they're, Elon Musk, you're somebody at that level, but no one, everybody can carve out 15 to 20 minutes a day. What would be an example of something that they could and should be doing within that time frame?
Yeah, I mean, I love Pilates, so I'm going to be touting that. It's a great way to improve your mobility and your core strength, your overall total body strength. Doing exercises and movements like that, where you're hitting everything, you're hitting your mobility, your rotation, within the spine, within the hips, and then you're also getting that stability aspect of, being on your hands and your knees, possibly doing things that you've seen in traditional physical therapy, like the bird dog, where you're extending one arm and one leg backwards, planking, and then, of course, the very famous core work that you do lying on your back. Those are things where you're doing a routine and you're hitting everything pretty quickly, and you're not like spending a lot of time just working like really small isolated muscles.
Do you see in today's sedentary society that people have more problems with their back having issues getting into flexion or getting into extension?
Extension.
Okay. And does that lead so TPI kind of coined the phrase, or early extension. They made it very popular in golf, and it seems like every instructor for the past couple of years is saying every swing problem is early extension. So in your opinion of the body and the way that sedentary, being in an office, driving quite a bit, sitting at home, watching TV on a sofa or a love seat, always bent forward, is that leading to early extension problems? And that they don't have the mobility or the flexibility to their body to move correctly, and that's going to lead to problem later on in their back?
Definitely, possibly. It's interesting. People kind of jump to weakness or mobility issues being the problem, but a lot of times the issue is like kind of an inhibition, a weakness due to inhibition, because you're in a flex position all the time. It's really hard for those hip flexors to actually fire properly because you have an inadequate amount of force that you're able to produce because you're in a terrible position to be able to get the hip flexor to fire. So I think that that's definitely overlooked often, and it's just kind of thrown, oh, you have poor mobility, but it tends to be more of a weakness issue.
So with the craze, so to speak, of moving back towards golfers being in the gym. So like
Mm-hmm.
the whole thing now in golf world is more distance. So swinging faster, swinging faster equates to force production, and you can hit it longer. And if you hit it longer, you have shorter clubs, you can hit it closer, et cetera, and you score better. So with I just wanted to try to clarify from my own brain. There's somebody out there listening. So the
Yeah.
positions that you're seeing people in, so like a sedentary position too often, that's leading the ability to either absorb or produce force at a reduced rate, and then that's going to lead to eventually to injury. It's compensation in some way, shape, or form.
100%. Yeah.
Would you do you see with being that you have an expertise in scoliosis? Do you see that a fair amount of that is caused not so much maybe by asymmetry in a sport? Is it just muscles get tight in certain areas because of the lifestyle that people are living right now, meaning they're not moving enough?
Yeah. Yeah. I mean, that's huge with the population I see. Tends to be, as soon as I get them moving, they're feeling better. And it may not even be the specific exercises that I'm giving them.
Mm-hmm.
It's a very simple addition. Just adding some movement into your life, it helps everything. So, but yeah, when you're more sedentary, especially with scoliosis, you tend to really relax into the path of least resistance. So for my population, that's their curve. So they're just resting in their curve. And then for other people, that just is kind of their baseline body mechanic position that they want to be in. So being in that position while you're working at your computer or while you're watching Netflix for hours on end, without those little intermittent bouts of getting up and going to get a drink or whatever, that's really adding up and contributing to a lot of injuries over time.
Would some of the things that you're trying to do with, say, the population that you and I work with more often, which would be retirees at clubs in this area, is it as little as getting them to just start walking, let's say a mile a day or every other day?
Mm-hmm.
And
Yeah.
what would the progression of that be? So let's say someone comes to you and you get them moving and say, hey, I need you to walk Monday, Wednesday, Friday, start at a half hour and try to work up to an hour. So 3 months later, they come back and say, I'm feeling better. I did it. I'm up to an hour every day. What would be the next step for someone like that to do? And it could be, I mean, we're talking about the baby boomer era. So this isn't just a particular to Hilton Head Low Country.
Yeah.
I mean, this is around the country and the globe. So many people are going to benefit. What would be the next step in the process? Somebody calls you up and say, hey, I want to play better. I want to feel better.
Mm-hmm. I would say trying to get in with a movement professional. So whether that's a personal trainer, a Pilates instructor, physical therapist, physical therapists, they tend to address more of like the orthopedic acute injury. It's not so much your wellness, your lifestyle conditioning. So possibly even a strength and conditioning coach might be a better option than a physical therapist for something.
And you have a background in physical therapy. Is that
yes.
not mistaken? Yeah. Okay.
Yeah. So,
so you're not just throwing them under. I mean, you've experienced. You've done that. It's not just like I don't like physical therapists.
Right,
that is your part of your expertise.
Exactly. Yeah. So there definitely there's a lot of benefit to physical therapy. Don't get me wrong, but if you're looking for something to perfect or improve your golf swing, probably going to physical therapy isn't going to be the route that you want to take. And then from there, like letting that professional take the lead there. If they're giving you a routine that's taking you longer than 20 minutes a day to accomplish, I would kind of veer away from that and press them harder to give you something that's more condensed, because you can get something really effective in a short amount of time where you're not feeling overwhelmed. And then usually longer programs are when you can get injured. So,
well, I'd say the thing I've noticed since I turned 50 just a few months ago is the ability to go in the gym and push it. So, okay, this is more or less the off season. So to try to lift heavier weights, lift 3 days a week and try to do cardio 2 to 3 days a week. To do that type of workout and then try to go play, the recovery is not what it was. When in other words, I'm feeling the age, so I can relate to try to keep, the older you get, try to keep your workouts shorter in duration, more specific, because it's going to, if you're looking at benefiting your game and your life, I think that's huge. I had Eddie Fernandez, Fast Eddie, as he's known, and Eddie's 53, I think, and he's number one long driver in the seniors in the world, and he's number 14 in the open division. And we were talking about his training and his time in the gym, and he said, look, his coach, or a guy that kind of helps him sometimes, says, or he might even said it himself, he's like, I'm not trying to set records in the gym. I'm trying to set records out on the golf range or the golf course. Yeah. And I mean, that kind of hit home for me, because anyone that's trying to achieve something, if they're driven enough, then they're trying to push it. But you have to kind of focus what you want to push on. And I think that's where some people lose the focus, is they get in the gym to get better at golf or life or tennis or whatever they're going to do. And then they start focusing on the gym so much that they forget that they're doing it to supplement their game or their lifestyle. And they lose kind of the goal.
Direction.
Mm-hmm. The direction. Yes.
Yeah.
Very easily.
Mm-hmm. Yeah. That's huge. And really, goal setting is huge with all of this too. What ultimately is your goal? So if you don't know what that is before you start kind of grasping at all these different treatments, or, implementing all these different forms of exercise, what are you really working towards? So setting those goals first.
So if that would be for your average everyday golfer, what would you, for your better golfer, so your single digit handicap to your club pro, since you're married to one, or someone that's trying to play, how would you see, because I'm sure you've watched golf on TV with Mark, and you've seen pros, and you're not a golf expert, but you're assimilated to the game enough that you know the body exceptionally well. What do you see that probably some golfers who are higher skill level might be missing out on, or what they should be doing?
I see sometimes I watch the swings and they just look painful the way that they're moving. So, that's something that comes to mind when I'm watching golf.
The violence of it?
The violence. Yes. It's extremely aggressive, and the force that it looks like it's the lower back is absorbing in that swing. It just, yeah. I don't really have a lot of words for it.
That's what Dan Hellman had told me, and he's a therapist and he's a coach, and his concern, and this is going back about 2 or 3 years ago when he was on, was that the rate of speed, and this was when the distance crusade, so to speak, was just gaining some momentum within the pro ranks. It was becoming the thing to focus on. He was concerned about the violence of the swing, and also with the wraparound season, that there was no more take 3 months off. That some of these girls and these guys they're playing 20 some weeks a year, but they're also practicing on their off weeks. It's like, when does your body get a chance to recuperate and recover? So he had that concern. So you're seeing the same thing, and I'm sure any physical therapist or trainer or anybody in that side of the sport out there is probably shaking their head up and down right now, thinking the same thing. And it's neat to have technology and all these things and stats and science to say, hit it longer. But it's like, okay, what's the residual effect? How long are you going to be able to hit it longer?
Exactly. Yeah, that's my thought every time I see it. I'm like, they're not going to be able to play for very long if they're hitting the ball like that. It's just cumulatively, it's going to add up and cause them issues. So
Yes, and now that, I mean, you've worked on your husband because he had a injury, and you've got me out of pain more than once. Um, so and a couple of those things I want to talk about the needling, because you do dry needling, and I call it the torture, because it's like, oh my God, but then all of a sudden within just a few seconds it's like it pain is gone. So can you, for what is dry needling? Let's start there, so it's somebody who might not ever heard of it and listening, that they'll have an idea.
Yeah, so a lot of people are familiar with acupuncture, and when they hear needling, they're like, "Oh, is it the same thing as acupuncture?" So acupuncture, it actually follows meridians within your body, so it's more Eastern medicine, a bit more. I actually don't know a whole lot about the acupuncture aspect of things, but the difference with dry needling, the way it came about, now I'm forgetting, his name is escaping me, but there was a doctor who was administering injections to his patients. He was doing like cortisone injections with them. And he was very curious. He was like, hey, I wonder if I can have the same effect of this muscle release and the pain relief by just inserting the needle into the trigger point. And he found that you can actually elicit the same response by just inserting the needle into the trigger point, because you're getting to the root of the issue. So there's a couple of theories as to why this works, just rebalancing the chemical balance within that muscle, and it's flushing kind of the toxins and the lactic acid into the rest of your body once you get that release. So that's pretty much how trigger point dry needling works.
So the muscle suffers a trauma, so to speak, from being either overuse or in use for an extended period of time. Let's say somebody's golf swing. All right, so they're swinging. They go out to range. They just had a lesson, or they're preparing for a big tournament, and then after the tournament, they obviously spend a lot of time. So the muscle has taken on a fair amount of trauma, extended use. So, and it hasn't recovered on its own. So it almost sounds like it's a way to kickstart the recovery by getting the muscle to release what it's been holding on to. Would that be a fair assessment?
Yeah, so it helps to improve someone's pain-free range of motion so that they can continue training and recover that muscle by strengthening it again. Because otherwise, you can go and get all the massages you want, but it tends to kind of have that trigger point continue to creep back up and show up again. The awesome thing about dry needling, you can, go in and needle, and it lasts for way longer. So
I would have to think
that's what I love about it.
Like if you took someone with scoliosis, let's say there was a overuse, or there's some type of trauma to the musculature that's got the spine out of alignment. And if it's not releasing or going back to where it should be, and you can go in there and do that for somebody, have you seen the success, I would have to assume, of being able to do that, and the spine slowly working its way back to some sort of equilibrium? Or any,
not as much that, but yeah.
Okay.
Like scoliosis is a bit more complex, because just kind of at the root of the spine, like the actual vertebrae, is shaped differently. It's shaped into a wedge. It's not just the muscles that are pulling and causing that imbalance. But for somebody that has a symmetrical spine, mostly symmetrical, not everybody, no one is perfectly symmetrical. Definitely that along the lines that you're talking about, that I've seen that happen, where I'm able to go in. It's a little bit of a different technique. A lot of times when we're working around the spine, you go onto a different, deeper level, not just kind of a superficial muscle. And you leave the needles in for a period of time, and it helps to rebalance your parasympathetic system. So you're kind of working more systemically within the body. and it helps to rebalance your right and your left side.
So is that because the subconscious of the brain is moving the body in positions to protect the spine, and it's gonna make muscles do things, tighten up or things like that you have to kind of get. You're working with two sides of the system there, and that you have to get one to relax before you can address the other one.
Yeah. Mm-hmm. That's exactly it. You're cutting.
Yeah. Is it harder with the spine because there's so many layers of muscle that go into the back, and what keeps it, you get the erectors, was it supraspinatus? My anatomy is lacking. I have not studied that in quite some time, but I mean, there's so many small muscles and bigger muscles.
You have a lot of different muscles that are incorporated.
Yeah, I could only imagine. I mean, I'm not. Are you there?
I am.
Okay,
You're
perfect.
just cutting out just a little bit. Sorry.
It's our wonderful internet.
Yeah. It's probably mine. I don't know. Yeah. So there's a lot of different layers that we're considering when we're talking about the spine. And what I'm specifically talking about are those deep muscles called your multifidi that run in between each vertebrae. And they're about as deep as you can get. And they kind of make up part of your core canister. So in order to support the spine, you want to be able to have nice flexibility and range of motion of those muscles. So that's why it's good to kind of start at that root instead of going, more superficially. Sometimes people get a little irritated with me. They're like, well, why are you needling there? My pain is here. But, they don't understand that kind of getting more to the root is going to create an overall change that they want. So
yeah, it's like the biggest bang for the buck. If you're going to, like in a training world, everyone's okay. If you want the biggest bang for your buck, you do squats, you do deadlifts, you do was it 4 or 6 exercise? I think it was shoulder press, chest press, rows, squats, deadlifts. Was it 5? The big 5, and because you work more of them, right? They're multi-joint movements. So if you're gonna try to fix the back, you go to the spot that's going to give the biggest impact, and then work your way to the smallest things, even though the pain might be at the smallest thing. Because it just seems like injuries or issues where you feel the pain is never where the pain actually is.
Yeah.
Why is that?
Yep, exactly. So
why does
like
pain
a lot of times
seem to radiate somewhere else from where the injury or trauma has taken place?
Yeah. So what I'm learning currently is a little bit more about the different systems of the body. So we obviously in PT school, we focus on the musculoskeletal system really heavily, and the other systems kind of get pushed to the side. And I'm learning from someone right now. Her name's Anna Hartman. She's the Movement Rev on Instagram. I highly recommend checking her stuff out. But
what's her handle? So everyone can go check it out.
The Movement Rev.
Okay. REV?
Yeah.
Okay.
REV. Yeah. Like Reverend.
The Movement Rev. Cool.
Yeah. In the course that I'm taking with her, she said that the primary role of your musculoskeletal system is to protect your organs and your viscera. So when we're getting pain in our musculoskeletal system, a lot of times it's because they're trying to protect something important like your viscera or your nervous system. So you get this splint that kind of happens internally, and all of the muscles kind of shrink down and contract around that problem area. So whether that's, that could be as deep as your liver. A lot of people have liver issues, your kidneys, your stomach, anything. So really getting to that root is super important, because otherwise you just keep chasing that pain cycle, and you're like, why am I not getting any better? I've been doing these rotator cuff strengthening exercises for like 3 years, and it's not getting any better. This pain keeps coming back. And it's really probably coming from, somewhere in a different system that you're missing. So
that's very interesting, because I've had a number of Czech Institute guys on, and they were all talking about like golf, that they're golfers associated with it. And they were saying how Paul Chek had taught them, if somebody has a low back issue, that it can go all the way back to something psychological. And they got into, okay, well, my back hurts. Well, why does it hurt? Well, your digestive tract's inflamed. Well, why is that inflamed? Well, you're eating the wrong foods. Why are you binge eating at 11 o'clock at night? Well, okay, whatever the reason was, the psychological aspect was causing them to eat. So it's like, okay, it's not necessarily a back problem where the pain, as we're talking about, is being manifested. It's like, you got to fix why you're eating shitty food at the worst possible time. Like before you go to bed, you wolf down a bag of chips and then wonder why your back hurts. Yeah. And then say, well, I play golf. Well, that's the reason. It's like, no, that's not it. So that's very interesting how you say that.
It's a lot less obvious.
Yes, I was listening to him the other day, how, most people don't breathe correctly. As you and I were talking about breathing, and, James Nestor and Patrick McEwen. And if for somebody to breathe properly, that the movement of the TVA, for those of you, transverse abdominis, it actually breathing correctly massages the organs. So, you breathe in and it exhales, and you move out, or your chest expands, and then you contract and everything. And I found that fascinating, and exactly what you're discussing. So I don't hear many talking about that, which is mind boggling, that if you have all these systems, it's like, okay, which one isn't working correctly? And let's find out the reason why.
Yeah.
Is it just that there's,
I'm excited to go ahead.
Is it just that the medical field has gotten so vast that there's so much to learn that you can't learn those things in school?
I think that we've gotten kind of tunnel vision, especially with PT school. You're educated, you're trained to pass your boards. And where you dive into this deeper work is clinically. And if it's not really of interest to you, you're just going to learn what your clinical instructor has taught you, or what your manager, your boss has taught you once you get out of PT school. If you're not motivated to, or interested, curious to learn more, you kind of keep the whole profession at this level that it's at. And there's definitely more curiosity out there, that I think that people are now diving into these things. The other thing is pride. You've done something for so long a certain way. If you may feel like, hey, well, that really like bruises my ego, and how am I going to tell my patient, like, I've been wrong all this time? It's an evolution. There's a change that's happening. There's nothing wrong with that. So being able to admit that, like, I don't know everything, and things change. So I think that that's a big piece of that.
Well, it is. Obviously the advent of the technology we have today, and the internet, of course, and the web, Mike Adams has won Coach of the Year multiple times, a national award. And he's mentored, I think, 3 instructors that have gotten Coach of the Year. And on this topic, I was listening to one of his lectures, and I think he went to Australia a few years ago, and then he went back a couple years ago, and someone said, well, you said this last time you were here, now you said this. He said, well, of course, I've learned since I've been here 3 or 5 years prior, and this is what the data shows and what the science has showed us that really works. And what I said before, it was right at the time, but we didn't have the information or the technology to learn what we do now. So yeah, I mean, you do the best you can with what you have. But I agree with you. I think Mark Twain's the one that said it's not what you don't know that gets you in trouble. It's what you know 100% that. That's just Megan's assistant, Nico. Don't worry about him. Let's see. So we're all good. Don't worry about it.
I'm not in a quiet area.
That's okay. Better to have you on in a loud area than not on at all. But yeah, it's how accepting that you need, if you're going to learn something, you got to sometimes admit that what you did know might not have been 100% correct. And to go forward is actually, you got to do all the things people get outside your comfort zone, have the, as you mentioned, the clinical practice. You know, a lot of people are noticing in clinic, okay, I've done all these things that I've been taught or that I know about, and that they're not quite getting to the level of activity or rehab that we wanted them to. So what am I missing? That's what a lot of the top instructors, coaches, it's fill in the blank, seem to be doing, especially in today's world where it's so readily available.
Mm-hmm. Yeah.
Your program, I want to talk about your program some, because I went through that, was it 3 years ago? But you have a very, like a step process.
Yeah.
You have a step program. So tell everybody about what that is and how that works.
Yeah. So this all focuses on posture and movement problems. So a couple of different spine conditions, scoliosis, kyphosis, so that rounded shoulder position that a lot of us are unknowingly moving into. We start off by doing a movement assessment, take baseline photos, so that we have a way to gauge your progress in addition to the way that you're feeling. Mm-hmm. It's a 6-month-long program where we take you from point A to, your goal where you want to be. And that is restored symmetry and movement between your right and your left side of your body. So we really begin very foundational, trying to get your foot and your ankle on your right side to move in a similar fashion to the left side, and then working your way up throughout the body. And then in phase 2, we increase the complication of the movements that we do. And then in phase 4, it's more strength-based. So it's all Pilates and movement-based, and you are able to see your progress through the photos that we take. It's really amazing to see, just by doing those simple exercises on a daily basis, the symmetry that you can achieve just from standing and squatting. So
if someone is athletic in their lifestyle, whether it's golf or tennis or running, biking, whatever they're doing, and so you take someone who's in an asymmetry movement pattern, how do you get them into more of a symmetrical movement pattern?
Yeah. So the first step is having that awareness and knowledge that you are asymmetrical, because a lot of people, they know that they have a problem, but they don't know exactly what is happening. So is that like, I
don't mean to cut you off, but just an example, would that be, for example, when someone's usually, when they're talking, if they're standing on the street corner and they're talking to a friend of theirs, that you tend to have a leg that you lean on more so than the other? Would that be like a base example, then nobody even pays attention to something like that? So for 100%. All you out there, next time you're talking to somebody, whether it's walking down the sidewalk and you stop, or you're at a mall or what have you, pay attention if you lean to one leg more so than the other. And that was eye-opening for me. I remember the first time somebody pointed that out. I had no idea.
Yeah, everybody has a tendency, and same thing with sitting. Tend to kind of sit and lean into one side instead of the other. And also, if you're a mom, your baby carrying hip tends to be the side that you even put your hip your hand on your hip when you get sassy. You kind of push that hip off to the side.
Hmm.
All those things are really interesting and add up to causing some pain and movement issues.
That's crazy because it's such a subtle thing, but you do it every single day, right? Without knowing. And pretty soon, you stack that on top of each other and now you got a problem.
Yeah. The exercises, the homework that I give my clients is paramount to them seeing the change, but also them making those adaptations to their daily living. So the way that they're moving when they're, doing their laundry, cooking at the counter, you don't even realize it. And you're there for half an hour chopping vegetables and your hips are smushed up against the counter and you're compressing your lower back for all that time. I guarantee you that half the people listening do that.
Well, yeah, and they don't even realize it. And I mean, if they're listening to the show, that next time they're in the kitchen. So if you're a golfer out there and your lower back is hurting and you've tried all these things and you can't figure it out, but you love to cook. And as Meghan just said, if you're leaning your hips into the countertop to brace yourself while you're setting the timer for when your back's going to give you a problem. When you, as you mentioned earlier on, because daily activities puts the body out of position, and then you go try to move it and fire in a pattern that it's not ready to fire in. It's a recipe for disaster.
Yep.
And do you always start with the foot and ankle complex because that's supportive, and then you work up from there?
Yeah. The foot and the ankle, that's the foundation of your spine, of your body. And then, if you are having shoulder and neck pain, there's this one particular exercise where you're doing like a repetitive motion with the foot and the ankle for a period of time. A lot of people notice that they're like trying to clench their jaw and tighten up their neck while they're doing it. And that's their main pain problem, is the neck and the jaw. Well, instead of starting there, like we probably normally would, addressing what's going on within the foundation of your body, like the foot and the ankle, that can resolve a lot of issues.
That helped me quite a bit. That's funny you say that. You pointed that out when you did my assessment, and when I had the GOTA guys on, I mean, their whole premise to their theory is that the feet have to be in a certain way where the outside feet are parallel so that the arch is supportive and the chain all the way up. And for me being a right-handed golfer, and that right leg or that trail side leg always kicking in, the arch collapsing. And I never realized when I was walking that whole right side was dropping. And, and you watch golfers on TV, like, okay, I know Phil Mickelson's a fire rod right now, or lightning rod for a lot of different reasons. But if he's one of the most that I've recognized it. When you watch Phil walk down the fairway on TV, so he's left-handed, but his left side is so much lower than his right for the same reasons. It's that trail leg is kicking inwards, and that arch is collapsing. And when you walk, it's not supportive anymore because, as you've talked about numerous times already, you have a sort of trauma, so to speak, to the muscle, and it's not recovering to where it should be, which is why you should go see Doc Meghan for needling. Right. So it can return to the position that it's supposed to support the body, the columns of the body all the way up. But that's very interesting because I don't hear a lot of people talking about that. You were one, Coach Gill was one, and all that, Hunter Gathright was on and he talked about it. But that's a huge thing that it's like everyone, I don't understand how some therapists will say, well, where the pain is coming from is often not the source of the problem. I've heard a lot of trainers and therapists say that, but then they go and they try to fix that area where the pain is. It's like, well, did you look at the rest of the human system?
Yeah. It's definitely missed. And, what I was talking about earlier about, the work that I'm learning from Anna, her whole philosophy is letting the body in front of you guide your treatment. So, just because I start with the foot and the ankle right now, I think that may end up changing in the future when I learn, more about where that body in front of me is telling me that it needs to start the treatment. So, just because you're having pain in your shoulder, it could be a nervous system issue. It could be a visceral system issue. Doesn't always necessarily mean that it's musculoskeletal. So,
would visceral be the soft tissue more so pertaining to fascia?
Visceral are your organs. So,
okay.
Yeah.
Yeah, my anatomy, like I said, it's not as polished as it used to be.
Yeah.
Someone out there's probably rolling their eyes and say, Jesus.
What is the viscera? And I was like, oh, I just kind of, I don't know. I just assume. So.
Because as you know, I had a lot of Rolfing done that deals with fascia, and then the Eldoa all pertains to fascia and getting that to release. I mean, there's so many systems. And again, the internet has brought a lot of that out. Now it's like, how do I sort through all this information to figure out what I need? But it's like, there has to be a little trial and error, even though you're working with experts in that field. It's like, okay, it might not quite be the right recipe. Or if it gets to a level that you've done it for a long time, it's like you might need to tweak it or add something to it. Great recipes don't ever stay the same. Well, maybe, grandma's apple pie or mom's lasagna or something. But, the bodies, those things aren't changing over time. They're not aging per se, like we are. Repetitive and they're in motion. What would you tell your younger self coming out of school? Like if you could talk to the 24-year-old Meghan, what would be the thing that you would tell her that you know now?
That you don't know anything.
I'd probably say something similar to myself. I mean, you come out of college and you spend 4 to 6 years, or some people longer, learning all these things. You do think you know everything. You're ready to conquer the world.
Yeah, I mean, gosh, yeah. I mean, things did not turn out at all how I had planned. I always thought I was going to be working for somebody else and had no ambitions of ever having my own business or anything like that. I just wanted to travel. I did travel PT right out of school. I wanted to make a bunch of money. I wasn't really actually super concerned with learning more clinically initially. But then when I grew roots and stayed in one spot for a period of time, that's when I was like, okay, well, if I'm going to do this, I want to be able to do it well as best as possible. So, I don't know that I would have taken a different path, but I think it's nice to continue to remind yourself that, like, even now, like, I don't know anything. Like, I may have a huge knowledge base and the experience that I have with scoliosis and orthopedics, but there's still so much to learn.
Do you think golfers, well, let me ask this in two ways. Do you think scoliosis in general, is that more of a predetermined condition? And then the second part of that would be, do golfers, because they are so asymmetric, do they tend to develop a scoliosis either on top of what they were genetically given or just off their repetitive motion one direction?
So there's a couple different forms of scoliosis. The two main types are the adolescent idiopathic scoliosis. So that's the stuff that's kind of predetermined. They're finding through research that there is a genetic component, but they don't really have like the exact link to that. And then the second type is de novo. So that's a type that develops later in life. So kind of after you're more so in like your 50s, you either get a compression fracture that kind of starts the vicious cycle of the asymmetrical loading of the spine and then kind of pulls you into that scoliosis, or menopause. Women are really lucky and they tend to get it more frequently than men. So, but they've found that there is a higher population of people that are like pro athletes who have scoliosis,
Mm-hmm.
and it's all athletics. So it's sprinting, it's tennis, it's golf, it's all sports across the board. So it's not necessarily the asymmetry of the sport that creates the scoliosis. So they're not really sure of that connection.
That would not golf, tennis, baseball. I could see because those are asymmetrical, and even this might sound crazy, but like running, because if you're a sprinter, you're getting into blocks probably with one leg forward and one leg behind you every single day as you train.
Yeah.
But something like more of a long distance running or swimming, basketball, even football outside of the quarterback, where people are moving in different directions. That one to me is perplexing because they're not moving in the same motion. They're constantly changing their movement patterns. I'm just, is there any, do you have a theory on why that would be developing?
So I'm actually really not sure. It's kind of like the chicken or the egg type of thing. Especially, it's also with ballet dancers and gymnasts, the population that has scoliosis is tremendously high.
Is that right? You would think that they wouldn't, because they're so balanced, so to speak, and that they're doing everything. Wow, that's fascinating.
Yeah, yeah. But there's the theory that you are a really fast runner. So Usain Bolt, he has scoliosis. So is he the fastest man in the world because he has scoliosis, or in spite of it? So I don't really have a good theory on that.
Is there a level of spinal curvature that would be deemed normal versus where scoliosis would technically begin?
Yeah. So in order for it to be classified as a scoliosis, it has to be at least 10 degrees or greater. And then it also has to show up in the rotation form. So scoliosis is often thought of kind of two-dimensional, just like that side-to-side curve, but there's 3 dimensions to it. So there's that rotational element to the scoliosis as well. And that's kind of what you see when you bend forward and there's that one side that's more prominent than the other. That's the rotation element. And that has to be there too in order to be a scoliosis.
So the transverse, the sagittal, and really try and pull from the memory bank on the
Coronal.
3. Yes.
Yeah.
So that's so for people out there who don't understand the scientific language. One of them is if you're looking at somebody, they're either lean to the right or the left, right? That's one. The other is if you're looking at it from the side, they're usually leaned forward, like an elderly person, hunched over more. And then the third one, I would have to imagine, would be the hardest to see, is where the spine is twisted, like you're wringing out a towel.
Yeah, exactly.
How does the last one where it's twisted, how does that manifest to where you can find it? Because it's the other two seem to be, they're easily identified or more readily identified because you can see it with the naked eye, but the twisting wouldn't be as evident.
Yeah, so the twisting shows up a lot in the rib cage. So the person that has the scoliosis, they'll notice that pretty quickly. Just when you're sitting in a hard chair with a hard back to it, one side of your rib cage will be resting against that chair and the other side doesn't. That's where that rotation shows up. And actually, the more rotated a person is with their scoliosis tends to lead more disability. So you tend to have a lot more pain, a lot more weakness, and it pushes you into more of a progression of your scoliosis. So that's one of the things that we really try to tackle initially when we're treating scoliosis, is reducing the rotation, because you can have a big effect on the amount of rotation that that vertebrae has and that rib cage has just by doing simple things like breathing. So,
do you see, what do you see with golfers that they have a more pronounced curvature? Would it be because they're obviously when you're set up to hit any shot, putt, chip, full swing, drive, you've got a forward bend reflection.
Mm-hmm.
They're obviously got trail side bend, which is going to tilt it, skew the spine one way. And anyone that has more than a brain cell knows that the golf swing, you got the rotary component.
Yeah.
So, I mean, that is exacerbating all three planes of somebody's spine.
Mm-hmm.
Do you tend to see golfers have one more so than the other, or is it all three just because the positioning the body's put in, all three are getting amplified to a greater extent?
Yeah, I'd say the rotation element and probably the extension element are the things that I see the most irritation with scoliosis. And for me personally, I'm just, trying to kind of learn how to golf with my husband. So having scoliosis, my biggest curve is rotated to the right. So when I was hitting, I was not able to get that full rotation to the left. I was kind of, hitting a wall there. So in order to help that, we changed my foot position, stepped my back leg back a little bit and opened it into some external rotation. So more of the movement was coming from my hips and it was less irritating to my spine, and it helped a lot. So I was able to hit a lot further then. So making adjustments like that are huge, and having somebody be able to see that in you when you don't know that about your own body, that can be the challenge.
Yeah. And you can, when you hear all these things, as you just explained, you obviously know the body, your husband knows the golf swing. You can see how some of these pro athletes nowadays have a team of people around them, because you can have just your swing, your hitting, or your throwing, or whatever motion is coach. And you might be doing damage to your body that you don't know. It's like, just grind through it. And now you can understand how they have to, or are beneficial to have a therapist or a trainer on their staff or their team, so to speak, because it's like, and then have all these people talking to each other. Colin Swatton was on. Colin lives here. Colin was Jason Day's coach. He was his mentor. He more or less like he adopted him. And Colin said he with all the physios and the trainer and everything, and he was the caddy and the swing coach. He kind of was the quarterback for everybody. Okay, everybody, let's get together. Let's compare notes. What do we need to do? I know Jason did have back problems for a long time. And now he hopefully, because he's such a good guy, he seems to have that behind him and under control, where he's making a push now to get back to playing some really good golf. I mean, he's the number one golfer in the world for a while.
Yeah.
And to see someone go down with back issues like that is, even with all the people he had around him, it's like, that's just an example. There's so much out there to know.
Yeah. I think what you said about having them communicate with each other, that's the biggest piece of the puzzle, because you can have all the people and they, Joe may be telling you one thing and Anna's telling you another thing, and you're trying to sort it out, like what's what. You're not really going to be getting the best comprehensive treatment plan that you could if you had everybody communicating with each other and giving you something.
10, 15 years ago, I had many debate discussions, so to speak, with colleagues that when a lot of the physics stuff came out, the TrackMans, and this is not a knock on TrackMan whatsoever, I think it's a great tool. But when some of my colleagues were gravitating like, oh, this is science, so this is the be all end all, and I'm like, okay, but that's the physics. What about the physiological side? What about the biomechanics side? It's like you can't just negate all these other things, but to fit numbers on what the screen's telling you, or trying to match those. I mean, you have to work. If you're trying to get someone to swing a certain way and it's contradictory to either how their body's designed or how it is compromised to play the sport, you're that road is, we all know where that road's going to end, and it's not good.
Yeah.
So that
end in my office.
Yeah. They're up on your table like I did with needles sticking out of them and saying, isn't it supposed to feel good?
No.
not in the immediate future. No, but it will eventually.
Yeah. Yeah.
Um, that's really, I don't want to take all your time, but the Scolio Pilates, talk about that and what you do with that, because that was very interesting to me. I had done a lot of, as you know, a lot of different things for the beat up body that I have from playing pro sports for a while. The Scolio Pilates is an interesting concept because it combines kind of a couple different modalities and sciences.
Yeah, yeah. So, um, combining that, it's really modified Pilates movements that incorporate all of the training that basically the Schroth method does. So that is looking at elongation. That is the primary pillar of the movement sequences that we do. So
And that's like fighting gravity, isn't it?
it is. So that's like if you just kind of hang off of a pull-up bar and let your feet dangle, just that nice lengthening of the spine. That's a form of elongation. And then the second pillar is breathing. So learning how to breathe properly, kind of like what Pete was talking about earlier. A lot of people are chest breathers just based off of our posture and our positioning that we assume throughout the day. We're also mouth breathers.
Mm-hmm.
So learning how to diaphragmatically breathe in order to achieve kind of like an internal pressure within your system to help expand your rib cage and stabilize your spine. That's, kind of the second pillar of the work that I do. And then,
well, before you go to the next
sure.
one, what would, how should somebody breathe? So while someone's sitting here listening, they can check to you go ahead and describe it so they can check to see if they're breathing correctly, which could be a catalyst to the problems that they're having.
Sure. So a really simple way to kind of check what your baseline is just having somebody breathe and watching them, because now they're going to probably change what they're doing a little bit. But if you want to assess yourself, you place one hand onto your chest, one hand onto your belly, and then just breathe for about a minute and notice if more of that breath is coming from your chest hand or more is coming from your belly hand. A lot of times you're going to be getting a lot shorter breaths coming from that chest hand instead of the longer and slower expansive breaths at the belly hand. So that's the goal, is to have more expansive breath happening from the belly, and that comes from more nasal breathing versus mouth breathing. The mouth breathing kind of perpetuates the chest accessory muscle form of breathing. So, just going on a walk and trying to walk the entire time with your mouth closed and pressing your entire tongue to the roof of the mouth, that is kind of a way to begin training your system to breathe better.
And as you and I have plenty of discussion, between the labyrinth of the nasal cavity, it heats up the air enough to where the lungs can convert it very quickly, as opposed to a longer step process. If it's getting it through the mouth, it's getting in too quickly and it's too cold to be utilized.
Right.
Is that wrong? Am I somewhere along the right line? Yeah.
Yeah. Mm-hmm. Exactly. And you're actually getting too much oxygen into the system with mouth breathing. You want to have kind of an oxygen deficit in order to metabolize it appropriately and get the diaphragmatic breath going.
Yeah, very interesting. All right, I didn't mean to get off on a tangent there.
Okay.
So,
good question. The third pillar is more of like the correction and the derotation. So that's what we were talking about with having that awareness of, okay, what is my baseline? How am I holding myself? And then learning how to adjust that to relieve the pressure and the discomfort that you're getting. And then the fourth.
So that one, not to cut you off again, but just to give somebody an example of what that is as they're listening, that would be if you're talking to somebody and you're leaning on one leg more than the other, or you're sitting in your chair and you find yourself drifting to one side, or the other. Okay.
Exactly. Yep. And that would also come into play with the rotation element if we're talking specifically about scoliosis. And then the fourth pillar is the stabilization. So once we get all of those other systems kind of in the most optimal alignment, then we want to stabilize it and strengthen it so that it carries over to your everyday life. So that's, really the way that you end up being able to continue on in this journey without having to return over and over again to your practitioner. You have all of the tools that you need, you're strong, and you know how to make all the adjustments. So you want to strengthen yourself within that new adjusted position.
So is one of the first steps is kind of between the needling and the scolio Pilates and all, it's opening up the tightness of the tissue to allow the structure to function the way it was designed to.
Yeah.
And then it's strengthening in that opened up position so it's strong enough to support itself.
Exactly.
Okay.
Yeah.
I mean, it's such common sense. It's like, why is everybody not doing that?
Yeah. A lot of people's, depending on the type of practice, if we're talking about physical therapy, your hands are tied a lot by what insurance allows you to do. So, I have that freedom with being a cash-based practice. I can treat my people the way that I want to. I have, an unlimited amount of time that I can be working with them.
Mm-hmm.
I don't have somebody's telling me I have to see them 3 days a week for 4 weeks and then that's it. So, yeah.
What's funny is we were talking about the Huberman Lab podcast earlier. I was told you I was listening to Andy Galpin, and obviously he's very good. He's world class, one of the best in the world at what he does. Dr. Hollis, Mike Hollis, who's been on, and the naturopath. I mean, some of these people are so smart and they have so much information that I have learned in talking to them. Like somebody will ask you, right? I realized talking to them, I was seeing this in golf as I got more and more information to use with somebody, and the podcast played a huge role in that. This is now, I think, coming up on the end of the third year, and that talking to world-class experts, and you ask them a question and you expect like this simple to do answer, and they're like, well, it depends. It's like, what do you mean it depends? Because the more you learn, you realize there's so many different things that are variables that you got to work with. It's not like there isn't a given answer. It's not like drink a gallon of water a day and you'll feel better. Well, what if it flushes all the minerals and nutrients out and their vitamins out of their system? That's not going to do them good. So it's like, that was somewhat eye-opening to me. It's like, and the more information I gather and more educated I get, it's like, I can see what they mean. Like someone will come to me and say, well, how do I fix my slice? Like, I don't know. It depends on what. Well, it depends on what the cause of the problem is.
What's your body doing? Yeah.
Yes. What's your body? Is it a swing issue, club issue, body issue? There's a litany of things. And then you dive into each of those columns to see, once you identify that, it's like, how far down this rabbit hole is this issue within that column? So it's not getting any less information in the world.
So kind of circling back to, we know nothing.
Yeah. I mean, it's kind of where we started.
Yeah.
I've had that conversation with a number of world-class researchers on here. It's like, of all the information that we have nowadays, we're realizing what we knew from the beginning is like, well, everybody's different.
Yeah.
You can't blanket statement and say everybody should swing this way, or everybody has to do this exercise, or everybody should do have this type of putter, or play this type of golf ball, or fill in the blank for whatever sport you're in or whatever activity you're doing. That's just not the way it works. We knew that from the beginning. Well, now we can quantify it.
Exactly. Yeah. Got to look at the human in front of you and kind of let them take the lead.
So anything that I should have touched on and missed?
I can't think of anything. I think we covered pretty much everything.
We got quite a bit. We got the
Yeah.
scoliosis, we got the Pilates, we got the programs you do, we got the I don't even like to say that word, but I mean it does. I mean, it's amazing how much my shoulder feels opened up compared to when you stuck it with the needle and it started quivering like like when you squeeze a bug and it just starts shaking all over the place.
Yeah, it's a weird sensation, but
yes, that
really
2 to 3 seconds of oh my god, and by the time you say that, it's like all of a sudden everything releases. So
yeah,
kind of like the ice baths. It's 90 seconds of torture, but after that you feel. For the next
I
3 hours, you feel.
That yet, but
you'll have to come over and check it out. It's only, like I said, it's bad for a minute and a half, and then for the next 2 to 3 hours, the dopamine epinephrine is through the roof.
Mm-hmm. That's cool.
But we'll get to it. Hey, I appreciate you coming on. It's always a pleasure talking to you.
Great conversation.
As always, and we'll have some more around the fire and around the dinner table.
Look forward to it.
Awesome. That before I'm going to sign off. Before we